Cell therapy in cancer is a big thing. It's none of my field. I am an ocular pathologist by training. I saw the only cancers I used to see the most were retinoblastomas. And mostly these retinoblastomas were in children, and we had to enucleate the eye. So you had to take off the entire eye. So many a times these kids would go blind, and and we would the child would come into the OPD with a red reflex, and then when you see it with the ophthalmoscope, you'd know it's a retinoblastoma, and then you have to take it off. So I always thought there could be something better. And then I got interested, in this field, of course, apart from treating myself from autoimmune disease. Now, talking about this cancer, because we don't have much time, you can keep changing the slides, okay? So, talking about this cancer, there was this era of genetic testing where we said cancer is genetic. So, then I questioned karma. If it's genetic, you can't do anything about it. But then we came to know it's not genetic. There is something called epigenetics, which turns on and turns off your genes. So what is that? That is metabolism. So cancer, okay, how do you change?
Just press the
green button. So cancer then became a metabolic disease, where the metabolism of the body changes. And this metabolism, as it changes in a cancer person, the cell voltages come down, the cell signaling comes down, everything comes down. So then we thought, okay, then came in the era of stem cells, CAR T cells, dendritic cells. Today we are talking about exosomes, tomorrow we'll talk about some other thing. But the whole crust of the matter is to repair the metabolism of the cell. And the cells metabolize. What does the cell metabolize? It metabolizes sugar. Sugar is the basic function of your cell, sugar and salt. That's why you have NS, which is your most common used fluid in the body. You have DNS and you have RL, which is the most common vehicle. If you correct the sugar metabolism, you never get cancer. Sugar is not bad. The way you metabolize sugar is bad. We are overtaking sugar. Okay, so coming back. So there is something called exosome today, what people are talking about. I see a lot of exosome, plant exosome, rose exosome. Every damn person is using exosome. Now, exosome comes from the word something is coming out of the cell. Okay? It's an excretion of the cell. So, unless you eat something, you will excrete something. Now, if you see in the cells, you have something called extracellular vesicles, where these exosomes are put, or these debris are put into something and thrown out. Every action in your body, okay, every cell function in your body has a byproduct. Now, when bacteria are present, sometimes you boil water. Why do you boil water? To kill bacteria and viruses. Can you inject that water? No, you can't inject that water. Why? If you inject that water, you may get a fever. Why do you get fever? Because this water contains the dead bodies of these bacteria. And these dead bodies of bacteria and viruses are called pyrogens. The word pyrogen, the word pyrogenic, which is fever. That's why when you're doing IV, it's important that your IV is not only sterile, but it is also pyrogen free. So, coming back, cell-derived vesicles were first discovered in 1940, and a plasma from your blood contains a lot of these vesicles. That's why after your food, if you see your blood, the plasma is a little milky. It contains something called chylomicrons, which is fat in your blood. And this is a very simple example of a extracellular vesicle. Now if you see, these are the different types of extracellular vesicles. Okay, so first you have the microvesicles, then you have apoptotic bodies, and then you have exosomes. So we are talking about this last guy, exosome. Microvessels is a broad thing. Anything that you want to throw out of the cell will come out in the microvessel. When you inject fillers, how does it go away from that particular site? If you inject a filler under the skin, the microvessels go out. Apoptotic bodies. When cells die, they form apoptosis. And you get these apoptotic bodies. Now generally, microvessels are surrounded by a phospholipid layer. This phospholipid layer is to protect what is inside, keep inside, and what is outside, keep outside. When you use, see, something was called PRP, or platelet-rich plasma. These platelets are microvessels. They also have a biphosphate layer, because you want to keep what is inside the platelet inside and what is outside, outside. And you collect them. We all know about the PRP revolution that happened. All of us practiced it. Apoptotic bodies. As cells die, you see these apoptosis or apoptotic bodies under the microscope, very commonly seen in dry eyes, in conjunctiva. So there is something called impression cytology, where you press a slide on the mucous membrane and you can stain it and see it. And you would see these apoptotic bodies, you know that the cells are dying. But if you put that same slide on a tumor and you see it, you won't see so much of apoptotic bodies, because cancer cells have forgotten apoptosis. Cancer cells die by necrosis. So when you see it, you understand that, okay, these particular cells are dying by necrosis. Exosomes were first described in 1983, and this is the beautiful part of it. They are approximately 100 to 50 nanometers. Now, you can quantify exosomes by virtue of their size, which is 50 to 100 nanometers. Now, why do you need to quantify them? Because any process produces exosomes. You will have inflammatory exosomes, you will have anti-inflammatory exosomes. If all of us had paracetamol or any drug today, we can test it in our blood, right? You can test the paracetamol in your blood. But if you have curcumin, if you have turmeric, if you have cucumber, if you have idli, if you have anything, can you test it in your blood? You have grape seed, can you test resveratrol in your blood? No, you can't. Why you can't? Because whatever you eat, first your microbiome eats. And after your microbiome eats, the microbiome spits it out. And that spit out is called your exosome. So generally, people would culture these cells produce these anti-inflammatory exosomes and then inject them into the cancer cell. So if your patient is undergoing a chemotherapy, you can definitely take these cells, culture them, put some amount of chemotherapic drug in the plate, get the exosomes out, it's very simple, and inject these exosomes into the body, and then the body will learn how to kill the cancer cells. You're reprogramming them. Now this is something for a size comparison. You see, this is a normal cell, this is an apoptotic body, this is a microvessel, and this is an exosome. Now exosomes are cell signaling factors. They only signal the metabolism of the cell. So if a cell, if you put cancer cells and you feed it vitamin C, or you feed it some drug, or you feed it some protein, it learns what to do. And what it spits out, those are taken and re-injected into the body. And that is how you create exosome in the laboratory. There are many kits available to collect these exosomes in the body, in the lab, in vitro. Now we thought of it, if this process can happen in the lab, why can't it just happen normally in our bodies? It automatically happens in our body. That is one of the principles of hypothermia, where you feed the body certain drugs, or you can feed it whatever, nowadays, B17 or whatever you can feed it, or you can feed it any of your chemo drugs, put the person in a hypothermia tent, exosomes are being produced at that particular time, and those exosomes go and, cause the cell, the tumor to, start necrosing, and basically it changes, it doesn't cause it to necrose more, it teaches apoptosis to the cell. Because the extra vesicle, the exosomes, get into the cell membrane and reprogram the cell. So this is cellular reprogramming. So exosomes are basically natural nanoparticles. Most of your nano drug delivery products are naturally produced exosomes. So if you have nano curcumin, it is a naturally produced exosome of turmeric. A nano ashwagandha is a naturally produced exosome of ashwagandha. All we do is just extract it. God creates the exosome. Exosomes are produced in the plants, they are produced in the animals, and they are produced in humans. Okay? So you see, I'll show you the next slide. Exosomes affect your protein synthesis because exosomes also contain mRNA particles. Now these mRNA particles is what people use to develop vaccines and change the protein synthesis and change the way your body reacts. That's why a lot of people after taking COVID vaccine, especially mRNA vaccine, have problem. Because they are producing exosome, but they are producing the wrong type of exosome. You have to produce the right type of exosome. Every mRNA particle will integrate, change your protein synthesis and produce a protein. Okay? So this is some of the biogenesis and the release of exosomes. It's a very small chart. I showed you the microvessels that come out, and you have the small exosomes, which are the cell signaling factors. The microvessels usually are the waste that we throw out of the cell, and the exosomes are the cell signaling factors. Of course, it's much more complicated, but just to make it simple. So almost all the cells in our body produce exosomes because they have to signal. When we talk about CAR T cells, when we talk about B cells, when we talk about dendritic cells, any cellular therapy works on cell signaling. And what does cell signaling do? Cell signaling changes the cell metabolism. So you're treating cancer metabolic disease. If you can treat cancer metabolic disease, two things will happen. The cell voltage in the body will increase and the biochemistry will change. If those two things happen, any cancer can be cured. It's just that we don't know how to do it. And we are trying. Sometimes we are successful, sometimes we are not. Okay, so the process of biogenesis of exosomes are divided into 4 stages. Initiation, endocytosis, multivesicular bodies, and formation of exosome excretion. I told you. So, initiation. How would you initiate the exosome? By first feeding the cell what it needs to be fed. So, if you want to do an endogenous exosome, you start feeding him all good antioxidants. Start feeding him good supplements. Start feeding him, along with your chemotherapy, give a small dose of the chemotherapy. So those exosomes that come out have the right signaling pathway. If you want to produce exosomes that have the wrong signaling pathway, start feeding him sugar. Okay? Start feeding him all the inflammatory diet, not anti-inflammatory, the inflammatory diet, and you'll get the wrong exosomes out. So when you're doing exosome therapy, patient preparation is the most important thing rather than the therapy itself. And that is why the CAR T cell therapy, NK cell therapy, many a time has failed. Many patients have come to us and said, oh, they have failed, and we have found out they have failed because the supportive therapies were not done properly. The supportive therapies of the nutrition, the supportive therapies of the diets were not done properly. If they were not done properly, obviously the cell signaling would not happen. And if the cell signaling doesn't happen, you won't get the final outcome, where you teach the cells how to die. Because all of us are going to die someday. But how to die is important. You die by apoptosis or you die by necrosis. So now if you see, there are different types of exosomes in the body. Exosomes have still not been specifically identified as to what exosomes does what. We get all these type of exosomes, but in the future, if we want to affect only the T cells, we'll use those exosomes. If we want to affect the T regulator cells, we'll use those exosomes. Those have still not been identified. They have been identified, but still not commercially been made viable or still not commercially been made acceptable. In fact, whatever we are doing in CAR cell therapy, in whatever we are doing in NK cell therapy, it's programming, okay? It's reprogramming. You're reprogramming your dendritic cells. And how do cells get reprogrammed? Again, by the exosomes. So exosome is something called a programming particle, I would call it. It's something similar to a lift, or any heavy machinery. The signal given to a heavy machinery is a very small signal. But once that signal is given, even a big motor can start. Like you can have your remote control, which is a very small current, which is a signal, and it can control the entire AC of your house, right? It's a very small current. So same way, exosome is something which helps start the particular healing process. Okay, so again, this is the same thing. This is in graphical form. So again, there are different ways of harvesting these exosomes. You can have, nanoparticle tracking analysis, dynamic light scattering. There's an instrument called zeta sizer, which works on Brownian motion, or the principle of Brownian motion, which causes this, and you can, collect it, water, Western blot, and whatever. But I say, all these things are too difficult and too expensive. As a clinical person, people come to us after finishing all the money, and then they come to alternative doctor. So we tried to prepare something which can be used by the common doctor for the common person. Not everyone can afford lakhs of rupees for a treatment. Those who are blessed can, but not everyone can all over the world. So I wanted to make some kind of a product that can be used for everyone and which will help everyone. So we've come out with a small kind of a kit, okay, which can extract these exosomes. And I think during the workshop we saw the kit and we did a workshop on it. And these are some of the, a study that was done. And you see that, we treated the lung cancer in this, and you can see the PET showing the difference. Okay, so this is the kit. I won't go through it. And this is the filtration. And the beauty is we filter the particles that come out are less than 100 nanometers. So when they are less than 100 nanometers, we know that these are generally exosomes. And we have tested a few, and we've got a good particle count under the zeta sizer. So we know these particular particles are exosomes. We've given it to people, and we've also seen a reduction in tumor size. We have treated about, not many people, but whoever we have treated like some breast cancer cells. We are going for some pancreatic tumors, and we have seen the tumor size coming down. Of course, I am not an oncologist, and my studies are private. I don't have any double-blinded, randomized controlled trials. That's a different story that Dr. Lenny will tell you about how they can have. And if you want this presentation, you can please scan it. And thank you very much. Thank you for your patient listening.
Thank you, Dr. Leroy. Any questions? Dr. Lenny, no question?
No, I know all of it.
Anyone? Question 1? Question 2? Okay.
Regarding ophthalmology.
Yes, sir.
We know that glaucoma is creating a lot of trouble for people.
Yes.
So, from your experience, which are the nutraceuticals which are relevant in eye remodeling?
Yeah. So if you see glaucoma, today glaucoma is defined as a neuro-ophthalmic disorder in which there is degeneration of the optic nerve characterized by, loss of optic nerve head fibers, in which the manipulable risk factor is eye pressure. That is what the society or the International Society of Ophthalmology defines glaucoma as of today, in which the only manipulable risk factor is intraocular pressure. Now, there is a lot of meaning to this definition, and towards the end, they say there is only one risk factor, which is intraocular pressure. But what about normal tension glaucoma, whether tension is normal? The first part of the definition I 100% agree with, the neuro-ophthalmic degenerative disorder. In such patients, many people of my family have glaucoma. I treat them like treating any other nerve degenerative thing with a good amount of MCT oils, because oils help building the myelin sheath, good oils. I also give them some good nutraceuticals for the eyes. Now everyone talks about nutraceuticals for the eyes as in Vision Plus or that lutein, zeaxanthin, astaxanthin, all the yellow things. That is definitely good for the retina. But what about the optic nerve? What about the aqueous? Very few people treat the aqueous. You need to give something that treats the aqueous. What would treat the aqueous? Now, in glaucoma, sometimes the aqueous blocks the trabecular meshwork where it goes out. Because of that blocking, That is blocked by generally dead cells. That's why there's something called gonioscopy, where we see the angle and we characterize the angle. Now, when these things get blocked, usually there is blood vessel inflammation. So you also need to treat the endothelium. And the eye has the maximum amount of endothelium. Because if you see the entire iris is made of small blood vessels. The choroid is blood vessels. The retina is small blood vessels. You treat the endothelium. So you treat endothelial dysfunction. I've also done chelation. I've also done ozone, because you need more oxygen. So you can do, ozone cup for the eye, because anyway the eye is, but you will get dryness. So generally what we do is that we wash with ozone water so that the cornea gets more oxygen. That's something that we do in glaucoma. Of course, I can't say I've got like 100% result, but definitely I have seen the Jacob's scotoma remaining there in the place, not expanding. I have seen the fields remaining normal, the microperimetry remaining normal over a period of years. When they stop the treatment, then I see a gradual increase in the microperimetry. So that's generally what we do, treating it just like any neurological degeneration.
Anyone else? No? Then can we please thank Dr. Leroy?
Thank you.